Another edition of our COVID-19 updates and info. Currently, we have with us Dr. Purvi Parikh joining us from New York City, and we're here located in New York City as well. Let's have her on the show. Thank you so much for joining us, Dr. Purvi Parikh.
Thank you. Thanks for having me.
Of course, it's so nice to have you here. You are associated with our family, but also more importantly, your expertise is in infectious diseases and immunology, pediatric allergy and immunology. So you're really on the front line with this coronavirus pandemic right now. My first question to you is, since we are a little tight on time right now, as an allergist, as somebody whose expertise is this, particular field of viruses as well, your take on having a strict advice for audience and your personal experience through this pandemic so far?
So in terms of advice, what we would like to tell everybody is please stay home. I know it's tempting to go out, but it's actually very, very dangerous right now because not only could you get sick, but all of our hospitals are completely full, especially in New York and New Jersey and the tri-state area. There's not enough hospital beds, there's not enough ventilators, and I'm already hearing from my colleagues that are in the emergency room ICUs that they don't have space for people. So we're already making decisions to let some people live and some people not live based on that. So please stay home because you're actually helping yourself and helping us buy time.
For sure. And then, I have to ask you this. It's something that I know you have a lot of expertise in, again, here, especially in this situation. We are hearing terms such as the emergency room has now become a war zone. Doctor, physicians, healthcare workers are really on the front line. Could you perhaps provide a picture of what's happening at these emergency rooms? Why are they being called a war zone? You yourself posted that, this is a time where you've seen truly the medical community come together. Your comments on what's happening?
Yeah, so it absolutely is a war zone. I personally am not an emergency room physician, but from all of my colleagues, what they tell me is that patients are coming in nonstop. Just from Thursday, some of the hospitals in this area have increased their capacity 85%, and that's in less than a week. So, there is a constant onslaught of patients coming in, and it's not all mild. These patients are very, very sick. So there's not enough doctors, there's not enough nurses. And then a lot of the doctors and nurses also don't have all of the protective equipment they need, all the gear that they need. So those resources are thinning out. The amount of hospital beds and sheer space is thinning out. So that's why it's considered a war zone, because there's a lot of people coming in. They're very, very sick. Sadly, we're seeing people die on a daily basis.
Do you see this as an impact? If someone has a lot of breathing issues, it's again a very associated questions with that too. If you have a lot of breathing issues or you are taking medication for it, again, is the advice to just stay home and be secure in your own home?
Yes, I absolutely would recommend it completely. Stay away from public transportation, away from large crowds. The safest, most controlled environment is your own home.
So I know we have you for a very short time period here right now, Dr. Purvi Parikh. And again, I really, truly appreciate you for giving this insight. Any current updates or any comments on the medications that are being used, any vaccinations that you can give us information on? And of course, I would love for you to give out a message to your fellow medical professionals and healthcare workers that are working on the front line with you.
Right. So in terms of medications, nothing is fully proven. This is a brand new virus, so we're learning about it as we're treating it, unfortunately. But we know that some medications are showing hope from what we've seen in Asia and in Italy. So there's trials going on for things like hydroxychloroquine, azithromycin, for some antivirals as well, just to see what works best. We can't say anything is definitively a cure or definitively will work until we collect this information. The same with vaccines, actually. There's two different studies started already, one by the NIH and one by some pharmaceutical companies. So hopefully we'll know soon in the next couple of months that, a safe and effective vaccine exists. And hopefully then that will also help protect everybody, But yeah, the biggest message I have to tell people, because we don't have a foolproof medicine yet, because we don't have a foolproof vaccine yet, the best thing you can do for yourself and for anybody else, again, is to please, stay home. A little bit of a sacrifice for the next few weeks, but you may save your own life or somebody you know.